I'm Dr. Meghan Barrett. I am a veterinarian in Hawaii, and I practice holistic medicine primarily, although I come from a Western background too. So my current practice is focused on acupuncture, nutrition and food therapy, rehabilitation, herbal medicine, and other modalities that can help with different things such as anxiety and many other issues. So we're going to be exploring the fascinating world of the fecal microbiome transfer and their effect on behavior in different species. We'll also learn about FMT application in humans for mental health disorders, and we'll learn about the science behind it, applications and implications for future research and treatment options. So we're going to start with basic understanding of what this is. So a fecal microbiome transfer, also known as a fecal transplant. There's also several other terms for it, but you may most commonly hear it called a transfer or a transplant, or FMT. So this is the transplantation of fecal bacteria from a healthy donor into the GI tract of a recipient. And so the first use of this type of procedure was actually recorded in a handbook of emergency medicine by a Chinese man in the 4th century. And it was in the Handbook of Emergency Medicine. So even back thousands of years ago, there was a form of this being used, although unfortunately back then it was described as being ingested orally. So it's a poop soup, which is revolting to think of. But if it's someone's life on the line and this is the thing that can help to treat them, then obviously it might be worth it. The first use of FMT in Western medicine was published in 1958 by some doctors in Colorado. They had 4 critically ill patients with Clostridium difficile, which you'll hear me talking about more throughout the talk. This is a type of pathogenic bacteria in the gut that can cause very severe diarrhea, can be very resistant to antibiotics. And so they were basically desperate for a treatment, and they did a fecal transplantation, and the patients were saved. The first randomized controlled trial in treating that type of bacterial infection with a fecal transplant was published in 2013, and the study was actually stopped early due to the effectiveness of the therapy, where it was 81% of patients had a cure after a single infusion and 90% after the second. So it's pretty amazing results that have been seen in certain things. So this procedure aims to restore the recipient's gut microbiome to a healthy state. And it's, like I said, been primarily used to treat these Clostridium difficile infections in humans, but now it is being explored for a variety of other conditions, including behavioral issues, which we're going to talk about more soon. Interestingly, in the States, human feces have been regulated as an experimental drug for about 10 years. In the UK, FMT regulation is under the remit of the Medicines and Healthcare Products Regulatory Agency. So in human use, it is definitely pretty strictly regulated. And so, and there have been studies that found over the years now that this type of treatment is effective and simple, and it actually may be more cost effective than ongoing antibiotic therapy and reduced antibiotic resistance in these type of bacterial infections in the gut. So it was once considered a last resort therapy, due especially to its unusual nature and the invasiveness, its perceived potential risk for infection. But a lot of specialists in infectious disease and other societies have been moving toward accepting FMT as a standard therapy, in particular for these bacterial infections of the gut. And just last year, a product was approved in the States, which is the first approved oral fecal transplant product. Typically, the transplants are either done rectally via an enema, or you can take capsules. There are other administration routes, sometimes a nasogastric tube, or they've also done them with endoscopy. But the enema and the capsules are typically the most common, especially when we're talking about relating this to veterinary medicine. So we can't talk about this topic without examining what the gut-brain axis is. So the gut-brain axis is the bidirectional communication network between the gut and the brain. And so you may or may not have heard of this before, but there is now a newer concept that the gut microbiome plays a key role in this gut-brain axis. There are a lot of different ways that the gut and the brain are communicating with each other. One of the primary mechanisms is through the vagus nerve. But we're seeing more and more through research that there is this microbiome gut-brain axis of the three. So it's a three-pronged axis. And we're seeing the importance of the microbiome having on regulating that gut-brain axis as well. So can't really think about the gut-brain axis anymore without at least considering the role of the microbiome in each patient for that. So the gut microbiome can influence brain function and behavior through various mechanisms. We're going to talk about these more, but it's through a lot of molecules like neurotransmitters, immune system effects, and metabolites. And interestingly, these FMT experiments that are being done provide some of the strongest evidence for the role of the microbiome in the gut-brain axis. A change in behavior in these recipients is crucial evidence for the existence of this axis and its influence on behavior. So the gut bacteria can produce neurotransmitters, and these play key roles in regulating mood and behavior. They can additionally influence the immune system, which in turn affects brain function and behavior, and the metabolites can directly also impact the central nervous system. So next, we're going to talk about the mechanisms behind how a fecal transplant could have any effect on behavior. Putting stool from a donor into a recipient, how could that possibly affect, your behavior and your brain health? So it's interesting. It's been seen in research that stress, including stress in early life, can significantly alter the microbiome composition, and this can have marked consequences on adulthood physiology. Especially studies that have been done in germ-free animals can start to really show us the way that this works. So the mechanisms are just now being able to be unraveled. We still have a lot of learning to do, a lot of science and research, but we're going to talk about how these mechanisms work. Okay, so how can it bring about these behavioral changes? So neurotransmitter production, like we said before, serotonin, dopamine, and GABA, among others, are very key neurotransmitter regulators in a lot of functions in the body. And a lot of these, the majority of these are produced in the gut by our gut microbiome bacteria. The immune system can also be modulated by the microbiome. 70 to 80% of the immune cells are present in the gut. And so there's a very intricate interplay between the intestinal microbiome, the epithelial layer, and the local mucosal immune system. And so it's, in addition to these local responses, it's also increasingly recognized that the gut microbiome can affect systemic immunity. And this is because the immune system is not just self-regulated. It actually functions in very close association with the nervous system. And so any alterations in those communication pathways between the immune and nervous system can account for many of the pathological conditions. And this really applies in particular to psychiatric disorders and autoimmune disorders. And lastly, the metabolic functions of the metabolites that bacteria produce and how these can influence the brain and behavior. A lot of these are molecules that are derived from fermentation and molecules that the bacteria will modify. So things like bile acids, short chain fatty acids, and also things like LPS, lactate, and B vitamins. And these can all sometimes have different levels in different psychiatric conditions. Especially there's been studies in depression that show that one of these metabolites will be low, and if they administer it, it can actually alleviate symptoms. Okay, so let's talk about dogs. And, we all know a lot of dogs have behavior issues. Anxiety and aggression are just two examples, but these are ever growing in our modern world, and they represent an important concern in the field of veterinary behavior because these disorders are often somewhat disregarded in veterinary clinical practice, even if they're paid attention to, there is not always a lot of good treatment options besides offering medications, which are usually behavior modifiers like Prozac and other similar antidepressants and SSRIs, or doing behavioral training. And so, these types of anxiety and aggression issues definitely can have a negative impact on the animal and the owner's quality of life. And unfortunately, these types of issues can result in abandonment and euthanasia of dogs. So, it's an important thing for us to be doing everything we can about. And there's more and more evidence showing how the gut-brain axis can be a part of this. So there are some novel therapeutic strategies being investigated, but we definitely need a lot more insightful research. There's a big lack right now. So the microbiome in dogs has been studied, and what they've found so far, this one study from 2019 looked at microbiome samples from dogs that were taken from a dog fighting organization and comparing it to dogs that have a more normal behavior characteristics. And they did find that there were statistical associations between that aggression status and the gut microbiome populations. So that's one piece of evidence suggesting that having a particular microbiome profile could affect or could have a correlation with the aggression status. Another interesting study from this year, actually, sorry, let me scroll ahead here. So this was a study that was performed to investigate therapeutic applications of FMT for behavioral comorbidities of canine epilepsy. And with epilepsy in humans and dogs, it's not unusual to have comorbidities of both anxiety, cognitive dysfunction. And so they did a study with several dogs and found that when they did the fecal transfer, and they did it multiple times, they actually did notice a significant improvement in certain abnormal behaviors, as well as the quality of life. So this is a promising study to encourage us to continue with the research that's being done so that we can hopefully continue to find good applications like this. Another interesting study was in 2023, a meta-analysis was performed, and this was looking at 64 studies representing almost 5,000 animals, and looking at the meta-analysis of all these different studies that have been done. Their conclusions that they came to was that animal behavior can definitely be modulated by the intestinal microbiota. It was effective at doing this. And they noticed that the largest effect on outcomes were related to mood, cognition, pain, and motor function. So that's exciting because there's a lot of different potential applications to explore with that. However, they did find that because this is a new area of research, and it's an interesting procedurally because there's a lot of different ways that this procedure is done. It hasn't quite been standardized yet. So they found that there was some study design flaws throughout. There were some high, unintended bias in a lot of the studies. So it was definitely seen and discovered that we need to have more safeguards for our methods in future study designs with this, which is an important thing to be aware of. So at this point, they're recommending that the current body of research be interpreted with caution so that we're not jumping to conclusions before we really know. But I think everything seems pretty promising so far. So human applications of this therapy there's quite a few. So obviously, as we discussed before, FMT has been explored and is currently being explored as a treatment for various GI diseases. That's a big one for it because that's what it's actually approved for use in clinicians to be using it for. But if you have a FDA in the US approved clinical study, then they're doing research in many other conditions, autoimmune, obesity, and other mental health conditions. So like it says there, human feces, at least in the States, are regulated as a drug, and the clinicians' hands are very tied, and they're not really allowed to use that therapy for anything besides that particular type of infection, and it has to be refractory to other types of treatments. So we're in kind of a weird time with it. I think it's maybe going to be similar to a lot of how the hemp industry was very locked down for a long time, but now it's more open-minded to using things like CBD. So maybe we'll see an evolution over the next decade or two of what's acceptable. When we look into this type of therapy for mental health disorders, we've actually seen quite a bit of promise for treating things such as depression, anxiety, traumatic brain injury symptoms, and autism spectrum disorders. So the principle is the same as we've been talking about. By altering the microbiome population, we can influence brain function and thus behavior. We'll look at some examples next. This is a list of many of the conditions that are being investigated currently or have been investigated a bit up to this point, different type of neurological disorders in humans that are being explored. So in 2020, there was a meta-analysis that looked at 34 different studies. And so, they went through this list of different conditions. For example, they showed the clinical trials that have been performed in patients with autism have definitely shown beneficial effects on neurologic symptoms. With MS, Parkinson's disease, and these have had several animal studies showing a positive effect, and these have been supported by some human case reports. Epilepsy, Tourette syndrome, and diabetic neuropathy were still limited to some case reports and a limited number of animal studies. And then stroke and Alzheimer's were only having animal models so far. So there are still a lot of research to be done, animal models, human models, but of course it's going to be slow and take several years for a lot more of these studies to come out. So an interesting study that I found in 2022, there was a study focusing on children with autism spectrum disorder. So this is a group of neurodevelopmental disorders that begin in infancy. And in recent years, the incidence of ASD in the world is increasing year by year. And we don't fully understand the etiology and the pathogenesis. And there's not really effective treatments. There's not enough effective treatments for it. So what's interesting is that in addition to the neurobehavioral symptoms, children with ASD often have obvious GI symptoms. And interestingly, they're actually at least 3 times more likely to have co-occurring GI symptoms than a neurotypical child. So, that alone is just a fascinating information that I didn't even know about prior to my research for this talk. Now, what was interesting in the study was that they found after receiving the fecal transfer, many children showed significant changes in their improvements in their behavior, communication, and social interaction. But they also reduced an improvement in their GI symptoms. And so it's not just having one beneficial effect, it could make it a potential for a very nice complementary therapy for this. But as we've stated already, not only are well-designed human studies are needed, we need a lot more research on the mechanisms and the safety and things that we'll be talking about next. Of course, our ethical and practical considerations are very important for doing this type of treatment. One moment. So for donor screening, we need to obviously ensure that donors are free from any transmissible infectious diseases and that they have a healthy gut microbiome. And figuring out what that is, because each individual is different. So it's not like a healthy person has this exact same microbiome as another healthy person. And we still have a lot more to learn about what that means. We also need to standardize protocols for this procedure so that we can ensure consistency and safety across the board. And that would also be important for research studies and comparing one set of data against another as we move forward with that. And of course, understanding the risks. The potential risk could include transmission of infections, potentially adverse immune reactions. So far, it seems to be very safe. I did hear that there were a few studies showing that patients had a fever during the initial phase where they did the fecal transplant and some patients developed a fever. But interestingly, in that particular study, another doctor was critiquing that their methods were a bit odd because they also withdrew those patients from their immunosuppressives abruptly just prior to the procedure. And so they thought that those were some confounding variables. So I would encourage anyone who's continuing to pay attention to this topic to really look at any new studies very critically in terms of their methodology and their study design, because this is a very new, pioneering field, and there's a lot of uncertainty about, like we just said, the protocols and standardized methods. So this is a fun part, talking about future directions and suggesting ideas. So let's see, next slide. There is definitely a need for more research, as we said. There is a lot of studies that need to be done, and the first of which would be looking at these risks and side effects, making sure that we can mitigate risks effectively. And there may be also other unknown effects of an FMT. I think as humans, we like to intervene when we can, but with something as complex as the microbiome, who knows what we're actually doing when we do something so drastic as this type of thing. Maybe I'm wrong, but it just, I think a lot of times when we try to help in some ways, there's always unintended consequences. So I'm curious to see what we end up finding with regards to this topic as more studies and research come out. We also need to identify the optimal donor profile and identify the characteristics of the donors, and also considering, how to choose patients for recipients, and also how to pre-treat them to increase the efficacy, and understanding the best and most efficient routes of administration and storage of the stool material. And of course, more mechanistic studies to really understand the exact mechanisms by which FMT is affecting the body, the brain, and our behavior. And of course, don't forget about our cats. There's obviously a growing interest in this application of FMT in small animal medicine, but at this time, there are few published studies that have tested the effects in the cat. Myself, as well as I'm sure many other clinicians who may have done this procedure, may have had their own observations about the efficacy and other effects besides just a GI treatment. Maybe you have seen behavior changes in some of your patients. And I think that this topic, the clinical science, is probably well beyond where the published science is. So, it is important for all the clinicians to be observing. If you have an interesting case, publish a case report so that others can know what you've observed. But current research that's being done, DNA sequencing studies to understand what the fecal microbiome composition is of a healthy cat versus a cat with GI disease. And we're currently investigating how an FMT will affect the microbiome of a cat with a GI issue. Hopefully, future studies will be performed examining the effects of FMT on common behavioral issues in cats, such as inappropriate urination and overgrooming. I think, in my mind, the times that I really want to reach for an FMT would be anytime we're going to be considering prescribing a SSRI or another similar type of medication for these types of mood modification disorders. And just being able to do that in veterinary medicine is really nice. We're not as regulated as human medicine, but obviously if you're a pet owner, don't try this at home. It's just a medical procedure. Definitely leave it to the veterinarian to do, but don't be afraid to bring it up to your vet. And they may or may not have even heard about it or done it before, and they may be interested in learning more about it. So you never know. If you think that your pets or patients are good candidates, then look into it, and you'll definitely be surprised, I think, by the amount of information that's out there, even though there isn't quite all the published data quite yet. So I'm wrapping up here. I do have some QR codes. If anyone wants to, if you're on a computer, screenshot this and check it out. Oh, sorry. Next slide. These are basically just to connect with me and check out my other content on all those social media platforms. You can find me at Dr. Barrett Vet, and that's also my website, drbarrettvet.com. If anyone has questions, feel free to reach out. I also have some free resources and downloads on my website, in particular, free download PDF with a lot more information about the gut-brain axis and anxiety and different interventions for that. There's also my nutrition book, From Basic to Bougie, a blueprint to upgrade your pet's diet safely and simply. And that's a good read for anyone who's trying to learn more about upgrading their pet's diet. And of course, that can help the microbiome as well. So I've got a lot of references here. This is a great rabbit hole if you're interested. There are so many interesting papers on PubMed and elsewhere. If you just start searching fecal transplants or fecal transfers, there's a lot of information out there. So I thank you again for having me. I hope this presentation has maybe changed your mind a little bit about what a fecal transplant is, and hopefully you see it as an exciting, intriguing thing and not so much as a scary poop soup. And luckily we have different ways to administer it now than they did long before. But I always joke that the microbes are really in charge, and we're just the spaceship for them to fly around in. So take good care of your gut and your pet's guts, and all will be well. So thank you again for having me.